Hello everyone, I am Dr. Archana, consultant nephrologist at Renova Hospital, Kompally. Today I am going to share a topic with you by name chronic kidney disease, that is CKD. So let me start with a myth that kidney disease is very rare thing in the society. This is what is a myth which is perceived by everyone in the society. But do you know that every one person out of 10 globally has a kidney problem? And it is chronic kidney disease is a leading cause of one of the leading causes of death worldwide. It is at the 16th position right now, and it is projected to be the 5th cause of death worldwide by 2040. Isn't it really worrisome? So let us see what we can do to prevent chronic kidney diseases or early identification of the chronic kidney diseases. Let us understand what is chronic kidney disease. Chronic means lasting for more than 3 months. So whenever we call a patient as a chronic kidney disease, the disease is already there for more than 3 months. The chronic kidney disease is usually irreversible, so it cannot go back to its normal functioning. It is progressive in nature, so at some rate it will keep on progressing. We cannot stop the progress altogether. At the same time, it is a permanent damage and it is not a temporary damage to the kidney function. Let us see what are the causes of CKD. Diabetes and hypertension are the most common causes of CKD worldwide and even in India. The other causes like glomerulonephritis, inherited kidney diseases, kidney stones, and autoimmune diseases, drug-induced diseases. These are some other causes of CKD. Let us see the high-risk factors for CKD. Let us understand who all are the people who are at high risk for developing CKD. As I said, diabetes and hypertension, that is high blood pressure. These two are the most common causes of CKD. Then the people having these two diseases are at maximum risk for developing CKD. In diabetes, very high sugars for a long time can also lead to CKD. High blood pressure, which is not under control for a long time, can cause kidney damage permanently. The other risk factors like obesity, use of painkillers, unsupervised painkillers for a long time, as well as the patients who are having family history of kidney diseases, and at the same time, patients who are having a habit of smoking. So these are the risk factors. So to enumerate it, diabetes, hypertension, obesity, smoking habit, family history of kidney disease, these are the risk factors for kidney problem. Coming to the symptoms of CKD. Unfortunately, CKD cannot be diagnosed without investigation just by symptoms at initial stages. Patients may have no symptom at all and it can be diagnosed only with the investigation. While some patients may complain of some vague symptoms like non-specific symptoms like fatigability, body pains, loss of appetite, or just feeling little down and not able to eat properly, vomiting sensation, nausea. These are some vague symptoms, or pains and aches everywhere in the body. This is also one of the symptoms. In few advanced cases, the symptoms like swelling of the legs, urine abnormalities, foamy urine, blood in the urine, these are all the urinary symptoms which can patient present with. At later stage, when there is more fluid in the body, then patient can develop breathing difficulties and inability to sleep because of that. And these are the advanced symptoms of this disease. Now, how to diagnose CKD? CKD cannot be diagnosed by symptoms. Patient will not come with the symptom and we will immediately label it as CKD. No. Patients who are at high risk, we ask them to keep on investigating themselves every 3 monthly to see the changes in their body so that we don't miss CKD, identification of CKD at early stage. Identifying CKD or diagnosing CKD, it's a very simple thing. It does not need lot many blood tests or urine tests. There are only two tests which are needed. One is the urine examination to check for albumin in the urine, and the second is calculating the GFR, that is glomerular filtration rate, which is calculated by using serum creatinine level. So these, let me just tell you in short about GFR. Glomerular filtration rate is the capacity of the kidneys to filter the blood and take out the waste material from the blood. So these are the very two simple tests, and these are not even very expensive tests to find out about whether the kidneys are functioning well or not. If these two tests are abnormal, then we can the doctor can advise you few more tests, specific tests like scanning of the kidneys and some other blood tests to know more about your disease. Coming to the treatment of the CKD. CKD, once it is diagnosed, the treatment starts from there. We want to aim at delay the progress of the disease. We cannot stop it. So at least we can try to delay the progress of this disease as much as possible, and treating the complications which are already happened because of CKD, and educating the patient for long-term treatment for this. In this initial conservative treatment, we ask the patient to have a lifestyle modification like quitting smoking, being active, being healthy and active, eating healthy, being active, and diet modifications like taking less salt, low protein, not very high protein diet like red meat needs to be avoided in these patients. The diet for CKD is quite individualized as per the patient's requirement, as the causes of CKD are innumerous and the diet varies from patient to patient. So we need to check all the parameters and then advise the patient about the diet. There are certain medications which can help in preventing the progress of the disease or delaying the progress of the disease. So these medicines can be incorporated in the treatment chart so that the patient gets maximum benefit of it. Apart from that, as the kidneys are damaged, there is an effect on the bones, the blood cells and other organs also. So to prevent those complications as well as to treat those complications, we need to put him on certain medications which will be given to the patients. Apart from that, there will be an education of the patient and the family for the long-term management of the CKD in these patients. CKD is usually, there are stages of CKD. From CKD stage 1 till CKD stage 1, 2, patients' kidneys are still functioning well. They try to function as almost normal, but there are some abnormalities are noted. CKD stage 3 is still able to maintain. It is also graded into two stages, CKD 3A and 3B as per the GFR level. CKD stage 4, the kidneys are almost heading towards non-functioning, and by CKD stage 5, they become completely non-function when the GFR drops below 15 ml, 15 ml per minute per 1.73 meters square. So these are the numbers which are calculated as the patient visits the doctor every time, and the medicines are given according to the stage and the complications developed because of the CKD.